Here's one major culprit that we don't look to often enough when we have pain. And it's a lack of strength. A lack of strength. I was just working out with a patient, a client, a friend, and we won't say who he is. I didn't ask him if I could talk about him today, so we won't. But he used to not be able to do push-ups like this because his wrist would hurt. So he had to do them on his knuckles. He would do knee ones on the knuckles. And we work our way up to this one's on the knuckles. We do these other workouts that strengthen the wrists that are difficult. He thought he never could do. And guess what? Now he can do it. He has no pain. He has no pain when he's using his wrists all day doing all these other things. He has no more low back pain when we strengthen all the muscles around in his low back and in his core and in his upper back as well and all over his body. Things that can help him bear the load easier. You do things that are difficult, they help you bear the load easier, whether it's mental or physical. You have anxiety, you have stress. And there's a lot to be said for other routes. You can go from mindfulness techniques and stress relief, all sorts of things. And diet is a huge one. But do things that are difficult, do things that are mentally challenging. And then maybe other things will seem easier. They will seem easy to you. Do something hard so everything else is easy for you. The same goes for biomechanically how your muscles work. The load that your body has to bear will seem easier if you're strong. It's a simple message, but it's so true, really throughout all of life. If somebody's shoulder is sore because they do this all day with the mouse, yeah, we definitely look at muscles that we're gonna wanna stretch that are overly tightened all the time, okay? Maybe you're hiked up, maybe your upper traps and your levator scaps are a little bit tight, right? Because you're sitting like this all the time, and we'll work those out. Maybe your front delt, if you're coming up like this a lot. The biceps are contracted. Maybe your pecs, you're rolled forward. But let's look at strengthening all these other muscles too, and let's look at strengthening them as well, not just stretching them, so that you don't have pain from the same load. If you work out in the gym all the time, and you go and you do difficult sets of squats, right? And you're able to do heavy weight now, holding a dumbbell like that. You go to help somebody move, and they say, oh, be careful picking that up, it's heavy. Typical person in everyday life would say, oh, I can't do that. They say, yeah, we don't want anyone to hurt themselves, obviously. I wouldn't even think twice. I'd be like, well, let's see, obviously within reason. I'm not going to try to lift a car engine like that. But things are so much easier than you ever thought they could be. You just had to take the approach that was difficult and attack the issue by strengthening yourself instead of doing things that are easier that will help to relieve the problem for you. AKA just say not using your wrists. Oh, this hurts. I'm not going to do that. I'm not going to do it. I'm just not going to use them like that anymore. I used them enough today. I'm not going to use them anymore. Well, they're going to hurt the same amount tomorrow when you do the same amount. They're going to hurt to the same degree. So unless you change something, unless you strengthen them, there's not going to be a change. So that's an important principle. I think it comes back also to finding joy in hard work, which we've talked about. It comes back to when in doubt, strengthen yourself mentally and physically. And when you're in pain, a big one is pain. You guys have to realize that exercise in itself is a big pain reducer. Okay, so if you're somebody that has chronic pain, consider doing exercise often, at least more often. We talked about that trial with all those people with osteoarthritis, and they gave them for a month, they gave them ibuprofen or a placebo and an exercise regimen. And they only were doing like 3 days a week, 45 minutes of exercise a day. And they actually had less pain than the group that was taking the ibuprofen, So it's just, you're releasing good endorphins, you're releasing more dopamine and serotonin, and it's increasing your testosterone, it's increasing your bone density, it's increasing your muscle mass, you can bear loads easier, it's just good for you. Blood flow, everything. Producing more brain cells, so that's what we got for you guys today. Very passionate about it. We're not trying to yell at anyone here. It's always just, it's always with good intention. We may seem intense sometimes, but it's because we want you to get up and do it. I want you to get up and do something about it. If you have chronic pain, and if you came to my office, I would absolutely help you. I would do everything I could that day on the table to help relieve your pain and dysfunction, 100% without a doubt. You don't come in and I'm going to say, nah, you got to go to the gym for But you know what? After I treated you, I would definitely give you exercises that I would hope that you would do all the time. And I would encourage you to do more difficult things over time. And you would be shocked how good you can feel if you challenge yourself. So, challenge yourself today. Have a fantastic one. Happy belated birthday, John Arminio. Happy belated birthday, man. I hope you had a great day yesterday. I'm going to see you today. So we talked yesterday. I shouldn't say I hope you had a great day because I know you're working. You know, maybe you got to have a few drinks while you were there, have some fun. Never mind. You have a beautiful girlfriend, so, you know. But I'm not looking at meeting ladies. I love you, man, and you're a great-hearted dude, and I'm very excited to hang out with you today. And you too, Mariano, I can't wait, man. We're going to be kicking it, Three Musketeers, and this one's for you, brother. It's Forever Your Day in the Book of When Wellness. Yesterday was Forever Your Day in the book. So, happy birthday, man. This is for you, what I'm about to say. What do you think I'm about to say? Graphonia simplicifolia. Remember when I talked about that on your birthday one year? Just funny because the running joke was, we don't even need to explain it. But I'm always saying these crazy words. So I hope you have a Graphonia simplicifolia seed day. Yeah. Contains 5-HTP. So could boost serotonin levels. Who do we got out here? Oh, thank you, Regate. I appreciate that. Just did a great workout. St. Pierre, man. Alexander August. That's right, Ma. I love you. You're so right, though. Roy, what's up? Dr. Junior Marable. Oh, thank you so much, Ivan. My man. I appreciate you. Appreciate that so much. Thank you. Ragazzi, I'm doing fantastic. What I got? Preston, what's up, my man? How you doing? Nickname, profile name, what's up? John V. Bonbon. Langoy, Emily, what's up? Langlois. How you doing, girl? Manuel Pagan. Manuel. Mano Salva. DC Hugo. What up, DC? And Carlos Kent's first one on. Appreciate you. Jordan Kiani. And I am Brian. What's going on? Have a fantastic rest of your day. It's all we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have a fantastic one. Thanks so much. And happy When Wellness. We're going to go enjoy this beautiful day.